તમે સાહેબ દુનિયાના કોઈ પણ ડૉક્ટર પાસે જતા રહ્યો, પણ જે નાના છોકરાઓને સ્કૂલે જવા પેટમાં દુખાવો થાય ને એનું સોલ્યુશન કોઈ ડૉક્ટર પાસે નથી. 89.6 FM રેડિયો રાજકોટ સાંભળી રહ્યા છો તમે, અને હું છું પૂર્વી સાથે. અરે આપણું રાષ્ટ્રીય બહાનું છે નાના છોકરાઓનું સ્કૂલે નહીં જવાનું કે મમ્મી બહુ જ પેટમાં દુખે છે, પણ એના દુખાવાનું સોલ્યુશન મળે ના મળે, પણ જે પેટને લગતા કોઈ પણ પ્રોબ્લેમના સોલ્યુશન માટે આપણે નિષ્ણાંતની જરૂર પડે છે, ને એવા જ એક નિષ્ણાંત મારી સાથે આજે છે ડૉક્ટર ટોમ ચેરિયન, જેઓ અહીંયા આપણી વોકાર્ડ હોસ્પિટલ છે ને એમાં મહિને એકવાર તો આવે જ છે, અને એમણે મોર દેન 1000 સક્સેસફુલ સર્જરી કરેલી છે ટ્રાન્સપ્લાન્ટની. હેલો ડૉક્ટર, હાવ યુ?
Hi, how are you? Nice to be here.
Okay, sir. Then let's start with a very basic thing where I wanted to know about that, the fatty liver. Is that a major issue?
Definitely. So I'm glad you asked this question first, because many people think that liver disease सिर्फ ये alcoholics में होता है. ये liver disease में alcohol नहीं पीता तो मुझे नहीं सकते. मगर I want to tell everybody that I have done more than 700 liver transplants now.
Oh.
I did about 400 transplants in London for nearly 15 years before I came back. And now the number one reason for liver transplantation is fatty liver disease. Fatty liver disease दो तीन कारण से होता है. Number one is obesity. That means आपकी height के लिए आपकी weight is more than it should be. Number one. The key feature is a fact called, not a fact, an mass index. So all of us आज Google में जाके देखना है क्या होता है BMI, और मेरा BMI acceptable levels के अंदर है क्या नहीं. Number two is sugar control. We are living in the diabetic capital of the world, India, and many of us are diabetic. मगर diabetes के वजह से fatty liver नहीं होता है, poor sugar control के वजह से fatty liver होता है. तो diabetic होने के बाद भी आप अच्छा sugar level कर सकते हो using insulin, medicines, diet, weight loss. So these are the two key reasons that is contributing to fatty liver disease, and a very importance of liver disease today in India.
Sir, just the random question clicked my mind while you were talking. So sir, our livers are so easily available when you do a liver transplant?
No. So there are two sources of liver for transplantation. One is a cadaver transplant, जो इसको brain stem death होता है. Usually road traffic accidents, एक दो बार stroke के वजह से brain has died, मगर सिर्फ वेंटिलेटर के वजह से उसकी हार्ट अभी भी चल रहा है. So from such patients, with the consent of the family, we can take the liver. That is called a cadaveric transplant. Very, very few happens. It is organized by the government. For example, in Maharashtra, ZTCC. But the vast majority of transplants आज भी इंडिया में living donors होता है. इसका मतलब इन जो रेसिपिएंट है तो पेशेंट का फैमिली से कोई उनको लिवर डोनेट करता है. सो वी देन टेक आउट अ पार्ट ऑफ देयर लिवर.
So doctor, I have understood that while I was a student, that the liver is something which recreates itself over a period of time. So if I give my liver to see, will I be able to grow my liver back? Is that true?
Absolutely true. In fact, the liver has got a beautiful regenerative capacity. And अगर मैं एक लिवर से एक 60% लिवर में निकाल दिया तो 6 हफ्ते के अंदर 90% of it grows back.
Oh.
No other organ has got such a great regenerative capacity.
And if I talk about the capital part of it, then what is the sum that person pays for getting the liver done, sir?
So the liver transplant usually costs between 20 and 24 lakhs.
Okay, you talking about just transplantation.
Transplants. And all the things that is required for the transplant until discharge.
Okay, sir. Now, doctor, coming to a very important question, that how would I get to know if my liver is functioning well or not?
The first point I want to make is that until about 60% of you is spoiled, you will not come to know, or you might not come to know, because खुदा ने हमारा लिवर इतनी अच्छी तरह से बनाया है अगर 50% 60% खराब होने के बाद भी you can almost live a normal life. That is the first point.
Oh, is that so, sir?
कि लोग मत वेट करना है कि मुझे सिम्टम्स कुछ नहीं है, मेरा लिवर अच्छा है बोल को. सो द की इज, आई थिंक, इफ यू आर वेरी फैट फॉर योर एज, इफ यू आर गॉट कंट्रोल्ड डायबिटीज, नहीं तो आप बहुत शराब पीते हो, तो बेटर एक 35-40 ईयर्स के बाद get some tests done. Simple liver function test and an ultrasound scan. बहुत चीज़ दिखाते हैं. वोकाट हॉस्पिटल में, मेरा हॉस्पिटल का नाम है साउथ एशियन लिवर इंस्टीट्यूट. साउथ एशियन लिवर इंस्टीट्यूट and Wokat hospitals now run a partnership. And in Rajkot, we are running a clinic every month for liver patients.
Okay, sir. What are the dates? Any specific dates when you are available?
We usually come in the last week of the month, but anybody who's interested can call our hospital number and we will automatically take down their names and the date of the clinic 5 days before we will call them. No issue.
Wonderful, sir. Thank you so much, sir, for joining us. And રાજકોટ આ હતા ડોક્ટર ચેરિયન આપણી સાથે. આવું છું થોડીક જ વારમાં. ત્યાં સુધી સાંભળતા રહો 89.6 FM રેડિયો રાજકોટ. હવે રાજકોટ બોલશે, દુનિયા સાંભળશે.